Hello, I'm Dr. Melissa Hague. I'm a practicing OBGYN. I deliver babies and take care of women through all ages of life. And this is my friend.
Hi, I'm Delane Vaughn. I'm a family practitioner and I help women reverse type 2 diabetes.
That's right. So an OBGYN is partnering with a doctor that helps reverse diabetes as we help counsel women on what they can think about when they find out they have gestational diabetes and things they can do. As medical providers, we may not be your medical provider. So we are not giving medical advice. We just are giving you some food for thought, some things to think about that are often not found in mainstream medicine.
Absolutely. And on that note, we are not your medical provider. And if you've been started on medications by your current medical provider, you need to be very careful as you are making dietary changes. Your medications have been started because of how you were eating. If you change that, you're going to need your medications adjusted. So you need to have a clear line of communication with your medical provider to keep you and your baby safe.
Absolutely. Because, like I always say, food is medicine and food is dangerous.
Absolutely. So we have slides. I'm going to share those and we are going to jump into some of this information. This is going to be how to collect the data and how to interpret that.
That's right. So if you missed the first video, we talked about how you were eating and how you want to be eating. And then this one is just the practical, okay, you know you have gestational diabetes. Just practically, how often do I have to check my sugars and what does that look like? So you need to check your blood sugar every day, 4 times a day. I know this is kind of crummy and I apologize, but fasting. So first thing in the morning when you get up before you have anything to eat or drink other than water, and then 2 hours after each meal. There are a lot of other ways you can do it. I mean, you can do it 1 hour after each meal, but most of us in medicine are just used to seeing 2 hours after each meal. We won't go into continuous glucose monitors in this video, but if you have access to that, I would encourage you to use that so then you don't have to poke yourself. And a lot of people have found that the supplies for their glucometer are not that much different than purchasing a CGM or continuous glucose monitor. So that's something to think about. Just keep in mind, if you feel bad and you think, I think my blood sugar might be low, check it. Don't just start feeding yourself, because if you have lived in a state of higher blood sugar for a bit of time, that feeling of your blood sugar is too high or your blood sugar is too low can actually be the same. And if you're not on any medication to treat your diabetes, you really should not have a blood sugar that is so low that needs to be treated. I mean, that would be weird, right? Like,
Absolutely.
weird.
Yes.
I mean, I'll have people that say, well, I felt really bad because my blood sugar was 80. Nope, that's normal.
80 is normal.
That's
but if
great.
you're used to running at 200 or 250, 80 might feel awful.
It might. And there can definitely be a period of, I would say, probably 2 weeks of where you're adjusting your nutrition and you're getting your blood sugars in a good place where you don't feel like yourself. You just feel a little off. So by all means, check your blood sugar if you think it's not okay, but don't just start feeding yourself because you think you're running low.
Really you feel poorly.
Right. Look at the data. Exactly.
Lots of us want to feed ourselves when we feel poorly.
We do.
And that's what leads to a lot of these issues. So absolutely watching that. Check your sugars.
Food is the drug of choice for many of us. So if you start checking your blood sugars and you see your fasting blood sugars are all running high. Now, when I say high, 95 is what most authorities say, or 90 should be your fasting blood sugar. 2 hours after your meal, we want it to be less than 120. So if you are not less than, again, some people say 90, some say 95, regardless, you're not less than that for your fasting or less than 120 for your post meal, you need to be adjusting your carbohydrates. A lot of my patients will say, well, I don't even know where to start. There's lots of great free apps on carb counting. Carb Master is one we've used. You have a few that you've recommended.
I have used Nutritionix, and it's not really a carb counter or an app. It's really just a place where they put all of the nutritional information in the same format, so it's easy to find.
So you can go online and find it. And I always tell people, if you just need somewhere to start with 30 grams of carbs per meal. Now, the problem is a lot of people come to this eating 3 meals a day and 3 to 5 snacks a day. And that is going to have to change. So in the beginning, if you still need snacks, try to make sure your snacks are not high in carbs. And when I say high in carbs, I mean, I want to be less than 10 grams of carbs per snack. So really like cheese sticks or
chicken breast.
Right. Things like that. But like I said, this is just a general guideline. If you're trying to look for somewhere to start, think about 30 grams per meal and very low, if no snacks at all. If your blood sugar is higher, you got to change things, right? So it helps if you have tracked your food. So you know, okay, well, if I eat a sandwich, my fasting or my post sandwich blood sugar is 150. Well, the bread is probably the problem, sister. It's not likely the lunch meat and the cheese in the middle. And we won't go into all of the food recommendations. I know some of you are like, oh God, lunch meat. Do you know when the last case of listeria from lunch meat was documented?
Not long ago.
But what about Sabra hummus or
Oh
spinach
gosh, yes, yeah,
or
yeah,
ice cream?
yeah.
Or, you know, when you talk
Just
about
in general, packaged foods.
foods to eat, packaged
Food is
foods.
medicine and food can be dangerous.
That's
Yes,
right. So
yes.
just keep that in mind. If you start making these adjustments over the course of 1 or 2 weeks and things are not getting where you need them to be, then there are other strategies that you're going to have to look at. A lot of times, if your diet coming into gestational diabetes was sad, and you make it happy, if you don't know what that means, watch the first video, and you make it happy, you will find your blood sugars normalize, and it's very easy to do. However, we're going to talk about some other things that you can try to help if that's not getting where you want to be.
Absolutely. So we are going to talk about exercise, sleep, stress management, those sorts of things. Before we dive into that, though, recognize you need to have some kind of log to manage these numbers. I really do recommend that you write it down.
Yes, see it in paper.
Yes. Our brain is this nebulous little thing, and thoughts come and go, and we lose them, and they don't ever come back sometimes. If the thought is, oh yeah, I ate that thing, and you don't write it down, you're not getting all that information. And it's very, very frustrating to feel like you are doing all the changes and you're changing your diet and you're working on it and you're doing the hard work and you're not seeing the changes on your blood sugars, but maybe you're forgetting 15, 20, 25 grams of carbs that you're eating in a day. And that can be a big change.
Right. And it also might help you realize, oh, wow, I eat a lot at dinner. And then my fasting blood sugar is always high, so that you can start making the changes you need to make to adjust your fasting blood sugar.
Absolutely. So there is a video on this YouTube channel where you found this video. There will be another video about how to do your finger stick or your blood sugar check, the AccuCheck machine. We call it the prick machine, how you use that machine and stick your finger and get that blood sugar so you can get that reading. So look for that other video on this channel. There is the effect of exercise. So this is one of the things, again, like Dr. Hague said, you go through and you make all your dietary adjustments. You find out you were eating 300 grams of carbohydrates a day before you came to your gestational diabetes diagnosis. And now you got that and you're counting it up and you're like, holy crow, there's a lot of low-hanging fruit I can pluck off here and get that number down lower.
Right.
And you get that number down lower, but say your after meals are still in the 130, 135 range, or say your fasting blood sugar is still in the 103 range or some low. What other things can you do to improve your blood sugar management before your doctor puts you on meds? So exercise is one of the most effective ways to get your blood sugar down. Okay. Again, there's no amount of exercise you're going to do that makes the Twinkie tree or the pizza patch okay. So don't think that.
That's so sad.
But if you've cleaned that dietary part up and you're still struggling to get those optimal numbers, exercise can be that thing that pushes you over. So exercise, your muscles, when we go into the exercise state, they want to use the glycogen or the glucose that's stored in the muscle. And when that's expended, when they've used all of that, they're going to go and use the stuff that's floating around, the glucose, the meal that you ate recently floating around your system. Once those things are all used up, your body is going to go to use the glucose that's stored in your liver. Okay. As your exercise intensity increases, your cells are going to actually rely on glucose that's floating around the world, either made by the liver or in your bloodstream more for fuel. So skeletal muscles specifically, when they start exercising, they bring sugar inside of the cell and burn that as fuel in a way that does not use insulin.
That's amazing.
It is the most amazing. It's like the coolest thing ever. Biology is so cool.
Well, because it means it lasts
really
long time, right?
Well, yeah. And so like, but you don't like, if you understand, so if you're not sure, check out the first video again, right? Insulin resistance is the issue here. You have to fix the insulin resistance because insulin resistance is what allows your blood sugars to go up when your cells aren't relying or aren't you able to utilize insulin. And they're trying to bring blood sugar in, but they're not able to use the insulin. That's what insulin does. When they're resistant, they don't do this well. When you exercise, we don't care about the insulin. It brings the sugar in anyway. It's such a gift. So it bypasses, when you're exercising, your muscles, your skeletal muscles start to bypass insulin resistance. So there's this immediate improvement in your blood sugar with that aerobic activity, But more than that, it can last for 24 to 72 hours after your
That
exercise
is
event.
amazing.
It's the most amazing.
And I have seen women improve their blood sugars by figuring out if I take a 10-minute walk after dinner, it improves my blood sugar the next morning. So some of this is you have to figure out
Yes.
you know, you got to collect your own data and you've got to write down, okay, I exercised after that dinner that I know was maybe a little more high carb than I wanted it to be, but my blood sugar was still normal. So you start to figure out how your body is going to respond to the different things you're doing.
Absolutely. Again, there is no amount of exercise that's going to make pizza or Twinkies okay. But if you're needing that extra kick to keep you off of insulin, to keep you off of meds while you're pregnant, again, adding insulin to insulin resistance, which is what gestational diabetes is never the answer. Okay. Keeping your blood sugar normal is the answer because that's safest for you and your baby. That's important. But understand that insulin is not the most ideal way to do that. Changing the foods that you eat and then adding these things like exercise. Other things to do, improving your cortisol a release in your body. That's going to be a sleep thing. That's going to be a stress thing. Learning how to de-stress. Exercise is a great way to do that.
It is. And exercise is so important in pregnancy. I tell pregnant women, try for 10 to 20 minutes most days of the week. And you want to get a little sweaty. Like that's how you know you worked. We don't want your heart rate to be greater than about 150 for a prolonged period of time. So more than 3 to 5 minutes, but intermittent bursts of activity, like when you go out and you go for a walk and then you intermittently jog a little bit, or maybe you sprint. I don't sprint, but maybe you do sprint.
Getting crazy.
Yeah. But doing things that get you a little sweaty, that really improve your insulin over time is good for your pregnancy too.
Absolutely. So remember, if you're finding this helpful, share it with friends, share it with your medical provider so that they can look over this information, tell you what they think, and they also have a good idea about what you're going to be trying to help manage your gestational diabetes before you go on meds.
Absolutely.
All right, we'll see you in the next video.